So there was a sister who knocked in our page. Her name is Dr. Shamima. Definitely we have not used the actual name. So Dr. Shamima, she's 32 years old. She wrote that she has a baby of 12 months and she's now pregnant of 19 weeks. And in her first pregnancy, she was suffering from postpartum depression, and she also had depression during pregnancy. She's now not feeling well, and she thinks that her mental health is not at all good at the moment. So she asks us that what can she do other than going to our center or taking our help. So she would be very grateful if we could help her through this video, or she requested us that if she could talk to us over the phone, it could be life-saving for her. So for Dr. Shamima, I have a few points that I would like to emphasize on this talk. The first thing is, definitely you can talk to us over the phone. We do this every now and often, like we do this every day. We do smartphone counseling. We do counseling with people who live outside Dhaka. We do counseling with people who live outside Bangladesh, like people or Bengalis living in Australia, in UK, in Middle East and USA. They regularly talk to us over the phone. We do smartphone counseling. Sometimes they want to do online counseling, so we sit at Skype or WhatsApp, and we have regular sessions with them. So we can definitely have a smartphone counseling with you, and I'm sure that you will be benefited. The second thing, sister, I want to tell you is that as you had a history of depression and postpartum depression in your first pregnancy, so this is an individual risk factor of having another episode or having another depression in your second pregnancy, and that's what exactly is happening. So just because you had a depression in your last pregnancy, this makes it so much likely that you're having this depression in your second pregnancy. And when you have depression, this is a clinical disorder. You need to get treatment. Like if you had diabetes, if you had eclampsia, you wouldn't just sit home and talk to your doctor or talk to your gynecologist and would expect that to heal for yourself. Similarly, now you're having depression. Definitely we can talk to you over the phone, definitely we can help, and definitely we empathize with you. But what we want to say is you need to take that treatment. And you know, depression can be totally cured if you have 1 or 2 sessions of cognitive behavior therapy. And also you need to know that there are medicines, there are antidepressants which are absolutely safe in pregnancy. Like you can take fluoxetine in your pregnancy state, which is safe. You can take sertraline when you're breastfeeding your baby, and it won't cause any harm to your baby. So what we would like to say is that, you know, you are suffering and we want you to come out of it, and for that you need to give us the license to help you. Definitely we can talk to you, definitely we can give you time, but sometimes only talking doesn't cure your depression. You need to go and have that medicine. Definitely you can combine that medicine. You can talk to your gynecologist, and we can also talk to them so that we can adjust your medicines so that they don't harm your baby, they don't cause any problems for yourself and for the pregnant state. But what I would also like to say in this regard is mental stress or mental distress is a very important risk factor for abortion. So just because you're depressed, just because you have high cortisol level because of your depression, this individually is a risk factor for having an abortion. This individually is a risk factor for your baby to suffer in the womb, because when mother is distressed, this transfers to the baby. There are lots of authentic researches which shows these findings. So you must take care of your mental health. You must take care of your mental health. Normally, when you go to a pregnancy checkup, when you go to a gynecologist, it's all about your baby. What's your baby's weight, how is the cord, and what's the EDD, and all sorts of that. It's not always about you, and it needs to be about you, because if you have a good mental state, if you have a good physical state, that will transform to your baby. If you have if you are happy when you are pregnant, if you pass a good time when you're pregnant, then this will transform to your baby and you will deliver a happy baby, a healthy baby. So this is very important, which should be planned in our pregnancy follow-ups. So my humble request to you, Dr. Shamima, is please take care of your mental health. We can definitely talk to you over phone, but don't have that stigma, don't have that shame, or don't have that misconceptions that no medications can be given to a pregnant mother. That it's absolutely not true. You can also take short-term benzodiazepines. If you have sleep problems, you can take antidepressants in lower dose, and inshallah that will correct your depressions, and I'm sure that your depression will get minimized, and you will have a better pregnancy experience than you had in your previous experience. So may Allah bless you, and we hope that your baby stays well in the womb, and lots of good wishes and prayers for you.